You will see here that the inner mask contains a one-way valve. We then push the inner mask into the corresponding holes on the inside of the outer mask until you feel it pop into place. We can then turn the oxygen on only and turn it up to 5 litres per minute. We allow the reservoir bag to fill, or you can flush a little extra oxygen into the bag with the oxygen flush button to speed things up a bit. We then proceed to place the mask on our patient's nose and tighten it at the back before checking again that it has a good seal. We may ask the patient to hold the mask in place while we tighten it. We then ask our patient to breathe normally in and out through their nose, and we observe the reservoir bag closely. It should stay about 3/4 full and inflate and deflate, as you'll see it is doing here. This shows we have the correct flow rate for this patient. Now we can start to titrate the nitrous oxide, starting at 10% and increasing at 5 or 10% intervals every minute, until the patient, dentist and dental nurse are happy to proceed.